My name is Dr. Namir Haider, and I'm the Director of Interventional Pain Management and Regenerative Medicine. So the SI joint, or the sacroiliac joint, is a joint between the tailbone and part of the hip bone in the buttock area behind someone's body. And essentially what happens is, often with age or with leg length discrepancies or with just arthritis, people get pain in this SI joint or sacroiliac joint. Often people who have had spine surgery, up to 34% of people who have spine surgery or lumbar fusions have been found to have SI joint syndrome after the surgery, because what happens is the spine becomes immobilized and then the SI joints have to accommodate for that immobility by sometimes mobilizing more, and over time they also become painful. So there are many different causes of SI joint syndrome. And initially, we try physical therapy and try various different treatments for SI joint syndrome. But if a patient has chronic pain that doesn't improve with therapy and injections and even manipulation, then we would consider SI joint stabilization. And SI joint stabilization essentially works in two ways. One is that by putting a allograft or a segment of a donor bone into the SI joint from the back, from behind, under X-ray guidance, we actually can open up, or what we call distract the joint. And that distraction itself can often cause a patient to have immediate pain relief. And we're finding in these SI joint stabilization procedures that we do, patients often right after surgery have relief because their joint has been distracted, so that it's not having a lot of pain related to the approximation of the joint margins. So that's one way it works. And the other way it works is that over time, the joint may actually fuse and does not have the significant mobility it used to have, which can also substantially reduce pain. So those are the two mechanisms that SI joint stabilization, or SI joint arthroplasty, or arthrodesis as we call it using medical terms, may help a patient with SI joint pain. Sometimes patients have one-sided pain or unilateral pain, but often they may have bilateral pain. So this is a procedure that, if necessary, can be done on both sides to help patients with SI joint pain.